When you're in the grocery store, you should think about following the guidelines of the American Heart Association as well as those of the American Diabetes Association. Since diabetics have higher risk for obesity, heart disease, and stroke, it's important for you to shop for foods that can help you manage your weight, cholesterol, and blood pressure. In other words, choose foods low in fat, saturated fat, cholesterol, and sodium. Let's talk about grocery shopping and reading food labels. First, we must emphasize that avoiding unhealthy foods, that is, foods that will make it difficult for you to manage your diabetes, your weight, and your overall health, begins with shopping. You will eat what you buy. Don't buy foods that you know aren't good for you and your family, and assume that you will have the discipline to avoid them once they're in your home. The time for discipline is in the supermarket. When preparing your shopping list, it's important to remember the recommendations we've already discussed regarding basic food groups. We have already talked about reducing dense carbohydrates like bread, rice, pasta, fruit juice, dairy products and starchy vegetables, and replacing them with less dense carbs like green beans, broccoli, carrots, salad greens, and tomatoes. We also talked about replacing dark protein sources like chicken legs, roast beef, liver, and steak with light protein sources like chicken breast, turkey breast, and fish. We also talked about reducing foods with saturated fat or trans fats like butter, margarine, and creamy salad dressings. But how do you know how much or what type of fat is in the food you buy? The answer, as you probably know, is to read the food label. Although food labels have a lot of information, you really need to pay attention to just a few items. Generally speaking, you can ignore calories, percent daily value, protein, sugar, and all the information below protein. Based on guidelines from the American Heart Association and American Diabetes Association, you can simplify food label reading by looking at just a few items. This method will help you lose weight, reduce cholesterol levels, and control your glucose levels. Choose food that have the following numbers on each label. Total fat less than 5 grams, saturated fat of less than 1 gram, cholesterol of less than 20 milligrams, sodium of less than 320 milligrams, and dietary fiber of at least 3 grams for bread, cereal, rice, pasta, and crackers. Please note that if you have a history of congestive heart failure or high blood pressure that's not well controlled with medication, consider reducing the maximum sodium content to 240 milligrams. Also, if you have a history of high cholesterol, consider reducing total cholesterol to less than 10 milligrams. Remember, the numbers on the food label reflect how many grams or milligrams are in one serving in the can, box, or bag, not the entire package. So remember, when you're buying foods, think of the numbers 5, 1, 20, and 320, or lower. Fat, saturated fat, cholesterol, and sodium are always listed top to bottom in this order in the food label. Also, note that your physician or other healthcare provider may not want you to follow these guidelines for your unique situation, so please check with your providers to make sure that these general recommendations are appropriate for you. You might be wondering about the carbohydrate content of foods you buy, since the carbohydrates are the components of food that raise your blood glucose levels. While it is true that only carbohydrates raise your glucose levels, remember, when you have high glucose levels, you are at a much higher risk for heart attacks and strokes. In fact, people with diabetes are 2 to 4 times more likely to suffer heart attacks and strokes than the general population. If you are making your food decisions based on which foods have the least amount of carbohydrates in them, you are likely buying foods with too much fat, saturated fat, and cholesterol. Thus, you may be buying foods that don't raise your glucose levels as much, but you're not reducing your risk for heart attacks or strokes, which in the big picture is what we're trying to do: reduce risk factors for complications from diabetes. For example, steak is a protein with virtually no carbohydrates and will not raise glucose levels by itself, but it is usually high in fat and consequently calories, making it difficult to lose weight. It's also high in saturated fat and cholesterol, causing cholesterol levels to rise over time and thus not reducing your risk for heart attacks or strokes. So remember, pay attention to the fat, saturated fat, cholesterol, and sodium content of food labels in the grocery store. Base your bread, cereal, pasta, rice, and cracker choices on selecting those with more dietary fiber. To summarize, make your food choices in the grocery store based on less fat, saturated fat, cholesterol, sodium, and more dietary fiber for breads, cereal, rice, pasta, and crackers.